and she is a passionate physiotherapist. She is Dr. Meghna Dave. She has dedicated her career to raise awareness and help people with movement-related disorders. She is known for her work on creating educational videos on YouTube channels HealthQ and helping people move better. Her topic today is practical tips to maintain healthy spine ailment and posture. We are very delighted, Dr. Meghna, that you are with us here, and you are going to explain us on the alignment of spine and how it has to be maintained. As all of us are now working from home, even practitioners are now working from home. So this, I guess, session is important for all of us, being a patient, being a normal, healthy individual, or a practitioner himself or herself. Over to you, ma'am.
Hello, everyone. Thank you, Dr. Karishma, for this lovely introduction. Before we start, just a quick introduction about myself. Anyways, we have received a good introduction from ma'am. I'm a physiotherapist turned YouTuber turned entrepreneur. So when I say I am a YouTuber, there is a lot of work and a lot of keen interest that I have got related to educating people about what are the common mistakes that we make while we are sitting, walking, etc. So what I'm going to do today in today's session is just going to talk about a safe principle that we follow. And it's very pretty practical principle that helps anyone, including practitioner or as a IT professional or let's say a working woman, to maintain a healthy spine. So that's what is the entire agenda that I have got in today's session. So let me share my screen and then we can start having the discussion.
Dr. Meghna, there is some error, some echo on your side. Could you just...
Okay, sure. Just a moment. I'll just check.
Or maybe some background noise.
Yeah, maybe there would be a background. I'm really sorry for that. Let me check. 1 minute. Is it better now or it's still the same?
It's still the same.
Still the same? Okay, 1 minute.
Just a hold of 1 minute. Thank you everybody for your patience.
Now it's better?
Yes, it's better.
Okay. Yeah. Perfect. Okay. And is my screen visible to everyone?
Yes, your screen is visible and you have put it on slideshow. You can please go ahead.
Yes. All right. So, so what I'm going to talk about today is something called a safe exercise program, which we have designed at our center. And the idea is to make sure that each and every working professional, whether they're working from home, working from office, or is using a hybrid mode of work, can implement it very easily. Now, why this exercise program? What is the need of that? So before that, I'll just give you a quick introduction about us. So HealthQ Rehab is a digital community and physio rehab platform. And we try to help people with movement-related disorder. So we are going to understand, learn, and discuss about it, right? So as we all know that majority of our day is spent at work, right? And our health and safety is also influenced by our work. Now, definitely we all are here health professionals, so there's no major explanation that I need to make, but this is a very common sense thing. But there are a lot of things that we miss out on these days because our nature of work has changed. Not only from after COVID, but in general, with the help of technology, even though there are a lot of things which has become better for us, but that has taken away some good ability of mobility, good access to sunlight. At the same time, the most important, we miss out on our natural posture, the curvature of our spine that gets compromised. So what is the impact, the clinical impact of this? The clinical impact whenever there is an extreme compression or else altered mechanics of spine is happening on a very consistent basis, it leads to risk of alteration in the natural body alignment and curves. There is a risk of repeated motion injury, and there is a risk of joint degeneration. So when we know this, that there is an impact, why not to come up with some practical strategies and methods which are sustainable to follow, and at the same time are helping us to constantly maintain the natural alignment of our spines. So the best way to work on this is using a three principle, or is a balance of three principle. And that is, first, to maintain a relaxed musculature. Second, to adopt good postural habits, the most important of that. And the third one is following a safe exercise regime. Now, what do I mean by this relaxed musculature? Now, whenever we are sitting or working or else are doing any sort of repeated activities, the sarcomeres and the muscles that are there, they are constantly under stress because of the gravitational force, because of the altered mechanics that falls due to the wrong habits that we develop over a period of time. Now, I don't think like nobody, it must be, anybody would be unaware of the fact that how our neck posture has changed the moment we have started spending more time in front of screens like phone, right? Like everybody is bending down and watching their phone like that. So what is happening? There is a constant pull, there is a constant stress that is following on this sarcomeres, which leads to strains, spasm, and repeated injury. That needs to be prevented, and the best way to prevent is to maintain a good relaxation of the muscles. Now, what are the different ways with which we can maintain this relaxation? The best way is using the ancient old practice that we are gifted with, especially in India, and that is meditation. Studies have proven that whenever we meditate on a regular basis, we start using our diaphragmatic muscles and start reducing the work of accessory breathing muscles, or else the accessory spinal muscles, which are also the leading cause of pain. So that is one of the easiest strategy that I believe exists for all of us. The second most common strategy to maintain a good musculature relaxation, or relaxation of the muscle, is to make sure that we adopt some natural habits of stress relaxation. Because again, studies have proven that stress, anxiety, worries are also some of the leading cause that keeps our autonomous nervous system very highly active, which puts a lot of stress and causes a lot of constriction, a lot of spasms in the muscles, which when is present on a very chronic time frame, it will impact the natural structure or else the natural physiology of a muscle. And that's why prevention of muscles from unnecessary strain and sprain is the key important aspect when we talk about muscular relaxation. Now, apart from that, there are some strategies which are beyond the natural ways. These strategies are, number one, you can use hot fermentation, cold fermentation. There are a lot of machines, modalities, relaxation, massage guns, stuff like that available these days. All you need to do is just connect with a physiotherapist, figure out what is the right thing for you, and blah, hola, that's it. You can just lead a very regular life, healthy life, moving life, just with the help of following these small practices. Apart from that, what is the next important thing? And I believe this is the core of every problem that exists right now these days related to spinal health, and that is postural habits. Our postural habits define and decide what kind of ailments or else what kind of musculoskeletal issues we are going to develop. So if we are naturally making sure that our posture is good, not only in sitting, but at the time of standing, at the time of walking, at the time of sleeping, we will ensure that a good equilibrium is maintained between your musculature, your overall body posture, or else your overall structure of body, and your muscle strength, stamina, and flexibility. So some of the key important tips that or as ideas that we can follow, be it practitioner, like since we all are practicing at home from home these days, is to make sure that we give adequate support to our spine. Make sure that we are using a small pillow or chair modifier that gives a good support system to your spine muscles. Even I would just like to show a small bolster here, which we have got here. So this is something that we usually recommend for everyone who is working from chair. When they are using this, placing this on behind the back, it corrects the posture automatically. So using these small tools like this, you or as any individual can make sure that the spine is getting corrected. It's staying in a very neutral position, in the right position for a long period of time, especially when we are walking. Otherwise, what happens? Whenever we are doing that, slowly, the slouching posture starts coming into the picture. The next way to prevent that is setting alarms, the most easiest way. Whenever we are knowing that we have to work for a long period of time, we can set some alarms of say half an hour gap or 1 hour gap. Whenever that happens, just tuck the chin, come back, make ourselves erect, and that's it. You have corrected your posture and you have prevented that posture from going from worse to still maintaining its natural curvature. Third, sit to stand activity, just getting up from chair, sitting down from chair. These are some simple, easy ways with which we can adopt a good postural habit. Now, apart from that, the last but not the least, and I believe we will have a good demonstration here, and that is safe exercises. So what do I mean by safe? Safe means safe, the exercises which are not going to harm more. Adequate, which are enough for your muscles to work in order to maintain good flexibility, blood circulation, strength, stamina, etc. Exercises which are free. Yes, what do I mean by free? They are not constricting, they are not followed by a lot of resistance in the body, but they are just free moving. Even that motion gives a lot of impact on our overall musculoskeletal and spinal health. And that's why that acronym comes into the picture: safe, adequate, free exercises. So I wanted to keep it more interactive. So what I've done, I have decided that we can do this practice together. So if I'm allowed to do that, can we have all together doing these practices so we can all feel the benefit of it? Are we ready? Yes, we can just get a thumbs up for this.
Okay. Do you want me to remove? So do you want a gallery thing? Yes. Okay.
Yeah, that should be fine.
Yeah, this is fine. Yes, we are able to see you. Yeah.
See me, right? All right. So let's do this exercises together. So we all can sit on the chair wherever we are sitting. Keep our hands on one on the chest, one on the tummy. Close our eyes and breathe in.
Dr. Meghna.
Yes. Am I audible? Hello? Hello?
Yes, Dr. Meghna, you're audible.
Audible? Okay.
Yes.
All right. Okay. So what I was saying that we can start with breathing exercise. So we can just sit wherever we are. Place one hand on our chest, one hand on our tummy. Close our eyes and we can breathe in, breathe out. Breathe in, breathe out. I hope we all are doing together. I'm not able to see everyone.
Yes, we can.
All right. Okay.
Yeah, please continue.
Breathe in and out. In and out. In, out. In and relax. All right, so what I'll do is I'll just stop the screen sharing. I would like to keep it more interactive so we can do it together. So next exercise that we will do together would be chin tucks, which is to prevent our forward neck posture. So all we need to do is just keep our hand on the chin and push it backwards. And then come back. 2, 3, 4, and 5. So this is one of the great exercises that we can practice throughout the day whenever our neck goes forward in this way when we are walking. Let's move on to the next exercise, and that is shoulder movements. So we can raise our shoulders up and then come down. 2, 3, 4, 5, 6, and 7. Now we can do some rotations. 1, 2, 3, 4, 5, 6, 7. We can do this anti-clockwise. 1, 2, 3, 4, 5, 6, and 7. And relax. I hope you could feel the mobility of your spine when you were doing this. This is specifically for our shoulders. All right, let's move on to your upper back, the thoracic region, keeping these hands forward. We can bring our hands back, stretch our shoulders. You can feel the pectorals getting stretched well when we do that. And then we come back. 2, back. 3, back. 4, back. 5, 6, 7, 8, 9, and 10. Thanks. Awesome. All right. So now let's move on to the next one, and that is the side twist. So what we can do is we can just keep our hand over your waistline, and then we can start bending on the side and then come back. Is it audible now?
Yes, you're audible now.
Okay. Yeah. So we'll keep our hand on your waist, and then we'll bend on side. 1, 2, 3, 4, 5, 6, 7. All right. Now move on to the twisting or a turning of the spine. So we can just turn on the side and then come back. You can just hold the chair like this, just twist on the side. 2, 3, 4, 5. Similarly on the side. 1, 2, 3, 4, and 5. All right. Now we're going to get a little more active. So we are going to get up from the chair and then sit back again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. Let's move our hands a bit. Let's free them up. So keeping the hand, you can just rotate clockwise and then anti-clockwise. Same way, we can make it up and down. We can stretch the wrist muscles by keeping the hand, pulling it a little forward, feeling the slight pull, and then coming back. Relax. Other one. Perfect. Now let's stretch our triceps and side serratus anterior. So keeping this hand and moving backwards. Feel the stretch, your latissimus dorsi, your pectorals. All these muscles get stretched. Hold and then come back. 2, 3, 4, and 5. Let's do for the other hand. 1, 2, 3, 4, and 5. And relax. Now, after this, let's move our legs. So, I will request all of you to raise the leg, ankles up and down like this. So, just make your legs straight. Pull the ankles, your toes towards you, and then release. 2, 3, 4, 5, 6, 7. I hope everybody is moving. 8, 9, and 10. And relax. All right. Now let's come back again to our breathing, keeping hands back on our chest, hand on the tummy. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. In and out. In, out. In and relax. All right. So yeah, these were the exercises. I just tried to kind of warm you guys up. Now coming back to the strategies that I wanted to share with you guys. I'll just quickly share my screen again. 1 minute. Is my screen visible?
No, it's not visible.
Okay, 1 minute. Just a moment. I think my internet connection is a bit challenged. That's the reason.
Should I do that?
Just give me a second. I'll just arrange this. Just a moment. So sorry for this. I'm just trying to. Okay, I'm not able to find the.
Should I share my screen?
No, that should be fine. I'll just like to share.
Yeah. Just try for 30 seconds or so.
Yeah.
Then we can.
Okay. What I'm doing is I'm just doing this through Canva, so that. Right. So I had something very specific to share with you regarding the wellness of spine in terms of women. I think I'm now able to share this. Is my screen now visible?
Yes, it's visible.
Where it went back. Sorry for this. It went back again.
10 minutes to go, ma'am.
Yes, that's it. Okay, just a moment. I lost this somewhere. I don't know, due to internet issue. Just 2 minutes.
Yeah, please do.
It opened and again it went away. I lost this again. All right. I'm so sorry for this. I'll just explain this from saying it's not coming. I don't know. All right. So the reason what I wanted to share with today's session was secondly related to women's health. So women's
Should I
health,
share my screen? Should I share my screen? If it's
ma'am, it's not the same deck which I've shared. It's
okay,
a it
okay.
had video
Please
in it. Yeah, so it had a video in it. So I was just trying to get that. So no,
go.
what I was trying to say is that when we are seeing at the study which is done by WHO, 2.4 billion people globally are suffering from movement related disorders which requires need of rehabilitation, out of which 1.2 million women are in India itself who are in need of rehabilitation services. Now, from where these rehabilitation needs come from? These rehabilitation needs basically come from the postural changes that are happening in our day-to-day life. Mostly women are more susceptible to develop age-related challenges, to develop menopausal related challenges, and also to develop degenerative changes in key joints in our body like spine, like knee, like your shoulder, etc. But spine is the forefront where major causes are happening. Now, when we talk about the strategies or what we can do in order to help women to get out of these challenges are three important things. One is the psychological aspect of the healthcare, which is this is the need of an hour to address, because women are more prone to develop mental health issues, which eventually leads to a lot of musculoskeletal changes. The second challenge that happens with women, it's the term of the deficiency that women are more prone to develop. Calcium deficiency, vitamin D, B12 deficiency, vitamin D deficiency, all of these three are also an important aspect of women's health and well-being. And third is adding physical activity to all these three domains. So when emotional well-being, deficiency or nutritional well-being, and the musculoskeletal well-being, all these three things are combined, then only we can achieve a better output of physical health and well-being on the spinal muscles. So yeah, that was the key takeaway which I wanted to show just through a small video, but unfortunately I could not play that. Really sorry for it. But yes, I guess I have completed on time. So any questions, anything you would like to ask?
Thank you so much, ma'am, for your insightful knowledge on the spine and alignment of the same. Taruna Jain is asking what relationship that is scoliosis of spine, and if you could say a few words on the same.
Are again of two types. One is the acquired and one is the congenital scoliosis. Mostly acquired scoliosis are lifestyle change related issues where there are two most important muscles, your latissimus dorsi and quadratus lumborum. They get tightened, and there is a parallel weakness on the gluteal muscles, which is your weakness. This imbalance related to scoliosis. The other in scoliotic patients is their thoracic mobility is also impaired. So usually the strategy that is being followed is starting with breathing exercises to improve the thoracic expansion, because that is the first thing to get compromised. That helps in improving the thoracic mobility. That further is followed up by flexibility exercises for the tight group of muscles, which is quadratus lumborum and latissimus dorsi, and strengthening program for the abdominal, deep abdominal muscles, especially at the same time the gluteal group of muscle, in order to get the right pattern. But at the same time, posture needs to be maintained in the right aligned way, for which the braces which are available in marketplace are very helpful. And at the same time, muscle relaxation techniques like meditation, yoga, or else you can say some methods that we at physiotherapy use, like machines like ultrasound, TENS, electromyography, and we use nowadays needling, dry needling as well. That helps.
Yeah, one more question. Pinakin Healing MND is asking, what is your take on electric muscle stimulation, PEMF, for neuro rehab?
Yeah, so if the PEMF, if it is done on element neurological lesion in a Faradic manner, then it is helpful. At the same time, in upper motor neuron lesion, also it is helpful. But having said that, we have to be very careful if the spasticity or any kind of tone related abnormalities are present in the patient due to some other issues, then that has to be a lot of emphasis that has to be kept in terms of that, and then only it should be given. Then it gives a better impact. Usually what we believe in, first we try to use the manual methods, the manual strengthening programs, and after patient has developed the right activation pattern, that's where we add up the PEMF to give more feedbacks to the patient that that's where the contraction needs to be done. So yeah, that's what we do in MND and other cases.
If somebody is having a minimal kind of spinal alignment is disturbed, so is there any walking technique or something that the patient can do just because somebody who is a lot obese and is not able to walk up, and any bed exercises or some walking style can the patient take into consideration while treatment with other modalities inside his body?
Right. So obesity and pain has a very direct link with each other, like because people who have chronic pains are also obese because they can't do physical activity, and that's why the more static exercises and weight bearing exercises comes into the picture. So here the idea is not to focus more on cardio or else combining cardio with weight bearing together. So simple stepping on bed, right? So sleeping down with knee bend and then stepping up and down is a very important exercise that we recommend. Same thing a patient can do marching at place, same way patient can do standing and marching at place. Now if that is also causing a problem, deep squat, there are something called as pelvic bridging exercise where a patient is lying down keeping the hands on side and then they lift their pelvis. So this is a very close chain exercise. Close chain exercises are very helpful in weight loss, at the same time improving the joint proprioception that helps to reduce pain. Same way minor squats, so we start with gentle squats and then gradually progress the patient to deep squat. So these kind of exercises are definitely given.
One last question, Neha Sathe is asking, any particular postures to get better sleep?
Yeah, so studies have shown that postures which are sidelined but with the leg crossed, keeping the pillow, where your piriformis muscle and your gluteal muscles are little stretched, are more helpful for better sleep. And that's where mostly people habitually also sleep in that way. Like when they will sleep, they will stretch their leg. So what is exactly happening? They are completely elongating their one side of the spine and then they get better sleep. So that is exactly the way they should sleep. The only thing they should make a modification is keeping a pillow between or below the leg so the leg is not falling downwards.
Thank you so much, ma'am. These are all the questions that were to be asked. Thank you so much for your insightful session on
Thank you so much for the
alignment. Thank you so much. I hope this is going to help everybody, every patient, every healthy individual, and also the practitioners, because the pandemic has basically put the doctors also into the online platform. Thank you so much for your insightful session. Thank you.